Howdy folks, Dr. Z signing in again for day 5 of VEDA 2014. And I'll say I'm getting a little more comfortable with doing a daily video. Probably not getting it out to you as often as I'd like, as on the times I'd like. But, my respect for the daily vlogger grows every single day. So today, I'm going to talk about what people do behind the counter, the pharmacists, the technicians, the managers, everyone. And hopefully I get a good overview for you guys. So when I say community pharmacy, what's the first thing you think of? Drop off prescriptions and you wait in the lobby forever. Then you walk up to the counter and the person in the white coat says it costs hundreds of dollars even though the insurance should cover it, blah blah blah. But on this side of the counter, there's a whole lot more going on. First, we take the prescription that you just gave us or was sent in by your doctor and process it in our system. We have to make sure that there is a patient, a date, a drug with quantity and directions, because how many are we supposed to give you and how are you supposed to take it, because we're mind readers, as well as a doctor with his or her signature, because anyone can write a drug on a paper, but with a signature it becomes a prescription. Then, after someone types in the prescription, the pharmacist verifies what's typed in our computer matches what the prescription says, and that it makes sense, because why would anyone want to take a suppository in their mouth? After the leaflet prints out, technicians or the pharmacist will then fill the prescription. It can be by hand, by finding a drug on a shelf, or by automated newfangled machines that count out the drug for you. Fancy. So you know what 70% of my job is focused around? The pharmacist, usually one for most pharmacies, must verify that every drug filled in each vial matches the drug that should be dispensed to the person it was prescribed for. And when you're doing hundreds of prescriptions a day, it can be quite time-consuming, specifically for the pharmacist. We do so much more on top of it. Quick rundown includes preparing immunizations for your flu shot or shingles shot if you're 50 and older, clinical monitoring like blood pressure, compounding, as well as so much more, all while continuing to make sure prescriptions walk out the door. This is more than likely why it takes forever to get your prescriptions done, because you're not the only person who needs medication. Now, one thing patients can ask more than why it takes so long is why the high price. Now, I'm going to draw out a diagram for the American healthcare system as it works today. Your doctor determines you're sick and says this drug will treat your condition. The pharmacy receives it and makes sure it doesn't kill you compared to what else you're taking. And then we bill your insurance. Your insurance quickly looks at our bill and makes sure it matches their preferred drugs, then tells us how much they'll pay for it. What they don't pay for ends up being what is called your copay. Sometimes it can be a lot because you're paying into a pool of money that you have to fill before your meds become cheap. This is otherwise called a deductible. Other times, the drug your doctor thinks is best doesn't fit in your insurance's preferred drugs, so they won't pay for it. There are many other situations that can happen when it comes to your insurance, but it's all a pain, and it's something we unfortunately have to deal with when it comes to your medications. In that case, we suggest alternatives to the doctors, and they either approve our suggestions or have to tell the insurance that their choice is medically necessary, otherwise known as a prior authorization. Then your insurance decides again whether they'll pay more for that prescription or not. Unfortunately, we pharmacists in the pharmacy are just the messenger in the game called healthcare. So please don't kill us. And that's what it takes to be a community pharmacist. Hit me up in the comments for any questions or comments, and hit me up on Twitter if you want to be a little more personal. Tomorrow I'll talk a little bit about health system pharmacy, which is the sort of flip side pharmacy if you don't want to work with people on this sort of level. So, till tomorrow, this is Dr. Z signing out. See ya!